So Andrew, it occasionally happens that a person who's participating in a trial will tell us that they feel it isn't the right decision for them. How do you approach that, and what are your guidance to the patient?
This happens on occasion, thankfully not too often. And by all means, first and foremost, a patient has every right to choose to stop participating in a clinical trial at whatever time point they want, even if they don't meet formal criteria for having to be taken off study. Let's say a patient will be removed from a study if the treatment's not working. If after a couple months we evaluate their disease and their cancer is continuing to grow, naturally we would take them off the study because it's not benefiting them. Or if we observe an unacceptable level of potentially serious side effects that may be life-threatening or affecting their quality of life too much. So those are reasons that are built in. But there are occasions where a patient says, listen, this is just too time-intensive. It's more than I bargained for. I will still talk with them and just make sure I understand their reasons. I'll always be supportive of their decision. I don't think I've ever tried to talk a patient into staying on if he or she has already clearly made up their mind. Sometimes at the start of a study or when a patient is deciding whether or not to participate, if I sense any reluctance on their part, I may try to get a clear sense of, listen, are you wholeheartedly committed to this? Because as I mentioned, joining a study is not for someone who's sort of maybe half-hearted or still unsure. I feel like they really need to enter knowing what they're getting into and being at least fairly committed to wanting to see it through and recognizing that things change along the way. But there might be circumstances, if I sense some reluctance from a patient at the get-go, I might actually discourage them from participating in a study. Now, we're always able to learn some information from a patient who's participating in a study and chooses to leave that study. Sometimes we'll replace that person if we need a certain number of patients to participate, the sample size of the study. But on the whole, I would say it is a relatively uncommon event, fortunately, and one that we try to avoid. But when it does come up, in the end, they absolutely have that right to make that decision, and I let them know I'm still happy to be involved in their care in whatever way they choose, or to, if they've come from another local oncologist, I tell them I'm always happy to serve as a resource or to work with their local oncologist in that situation. Or if there is another trial that comes up in the future that they might be a candidate for, that we can always keep that option open for them. How do you deal with that circumstance?
Yeah, no, I think that's very comprehensive and thoughtful, your answer, and I agree, it's a rare event, and I think that's perhaps a credit to hopefully the process, and it's fair, and I think patient autonomy is key, and at the end of the day, what matters to them is what matters to us, and like you, we'll discuss the reasons why, and sometimes it might be that continuation is the right thing after we reflect on it, but as you said, at the end of the day, if it's not the right fit, it's not appropriate that that person would continue, and we reassure them that we're here to take care of them, whether it's part of a trial or not, and that's not going to influence how we approach looking after them, and that their well-being, again, is paramount.
So one circumstance that occasionally arises actually is for randomized studies, which we talked about, where a person can be randomly assigned to either the standard of care treatment or the experimental treatment. In those situations where it is not blinded, where the patient knows what arm he or she is receiving, it has come up on occasion that once they find out which arm they are assigned to, they choose to drop out before they even start treatment. Again, they have every right to do so. I try to encourage them before they enter a study, and sometimes I'll just ask them flat out, are you comfortable participating in a study where you may receive just the standard of care treatments, and just try to get a feel for them that way.
I agree, and we always have to acknowledge, right, the question is there because there's equipoise in the field, that we don't know which is the better approach. But if there is ambivalence, it's probably not the right thing for the person to participate.